Welcome to Health Talks. I'm Gail Hogan, and today we're talking with both doctor and patient about deep brain stimulation, a fascinating treatment for patients with Parkinson's, tremors, and more. Dr. Zachary Jordan and Billy England, welcome to both of you.
Thank you.
Dr. Jordan, I'm going to start with you with an explanation of deep brain stimulation, or what some people call DBS. What is it?
Sure. So deep brain stimulation is a surgical procedure in which we insert an electrode to a deep structure within the brain. And this allows us to send electrical current and change the function of that part of the brain. In this case, this allows us to suppress tremor in a way that goes above and beyond what medication is able to accomplish.
Can you explain what tremor is?
So tremor is a rhythmic back and forth movement of the hand or other body part. You might know it in conditions like Parkinson's disease, but it can also be present in conditions like essential tremor.
Just by itself, essential tremor. So how does then DBS work for these patients, like Billy?
So there is a circuit that's deep within the brain that we think is responsible for this tremor. And by disrupting this circuit, we can suppress tremor.
Who's it for? You mentioned it's for people with Parkinson's and essential tremor. Are those probably the basic patients?
Typically anyone with tremor who has not had a really great response to medication, or people with tremor where it's really affecting what they do day to day.
So Billy, I found out from you that you just had this, 6-9 months ago, or not too long ago?
In May of 23.
How has it affected your life so far?
Well, I can write again, and you can read it, and I can play music again. I'm a brass player. I play mostly trombone and tuba, and it's greatly improved my playing, which I had pretty much quit for about 3 years.
What was your diagnosis?
Essential tremor. I had seen 3 neurologists before coming to OSU and tried many different medications, and none of them were effective.
Can you describe your symptoms for someone who doesn't know what this is?
Well, if I was trying to write, my hand would be like this, and it would be almost impossible. I had to steady it with my other hand. Eating was becoming difficult, shaking, coffee spilling, things like that. And then trying to play a brass instrument was almost impossible. And it progressed over about a 20-year period, slowly.
So how did deep brain stimulation help you?
Well, it is not completely gone, the tremor, but it's much better, and it's adjustable. I just had an adjustment this morning with Dr. Jordan, and it's made it possible for me to play again, and really life is just a lot better.
It sounds like it's life-changing, actually.
Oh, yeah. These day-to-day things were becoming very difficult.
So Dr. Jordan, he mentioned that it was adjusted. It's pacemaker, I guess. What do we call it, the actual device?
Yeah, it's a deep brain stimulator in the chest. It's called an implantable pulse generator. And this device sends pulses of electricity to that part of the brain. And in the clinic, we can change it. We can increase the stimulation and change where the stimulation is being delivered, so that we can optimize the effect and improve tremor on a continuous basis. Even though this tremor tends to worsen over time, we can continue making adjustments and get a very durable effect.
So the patient themselves does not turn this off and on. It's constantly on?
You have the ability to turn it off and on, and you have some ability to adjust it yourself as a patient, but we set the limits for you in clinic.
Billy, this is going inside your brain. How did you feel about that when you were first learning of what it entails to get this surgery?
Well, a friend told me first about a different procedure which is not invasive and requires no surgery, but it actually is an ablation which kind of kills part of your brain, but is effective for some people. I liked this better because it's adjustable. I turn it off at night when I sleep. I have 3 different programs currently that I can try, and I can also adjust each of those programs myself a little bit up or down. And it's, I didn't find out about it until I came to OSU, and I was talking to them about focused ultrasound therapy, but it's not adjustable. It may be very good for some people, but I thought this was more to my liking, where it can actually be turned off or adjusted and changed, and to me that's everything. I mean, I like to be able to get an optimal result.
Were you apprehensive?
About a month before, I started getting pretty nervous about it, yes. But up until that time, it was about 5 months of testing and talking to different people and going for different tests and MRIs. And I wasn't too worried, but about a month before, I started getting kind of anxious.
I can understand that.
Yeah.
But it has improved symptoms.
Yes.
Dr. Jordan, this is a big surgery. How do you help patients get over that maybe bit of anxiety or apprehension about the surgery?
So my typical approach is to talk through the types of things that are difficult to do day to day and really try to help people envision what things could be like if tremor weren't a factor. And if that makes sense to move forward with something like a brain surgery, then we can talk about that and what that's like and how that could change things for them.
And doctor, this was 2 surgeries. Why 2 surgeries for this?
So it's done a little bit differently at different centers, but here we like to place the stimulating electrodes in one surgery and place the device in a second one. And I don't have a better explanation than that.
Maybe easier on the patient, too?
It might be easier, too, yeah.
And how long did it take for you to feel those effects, Billy?
When they turned it on, the effects were immediate. It was already a huge change, enough so that I bought a new trombone and a new tuba. So
you could resume your daily activities?
yes, everything was immediately much better. And then we've made, I think I've had 4 adjustment appointments, and each time it's gotten a little bit better.
Now, are these results going to be permanent for Billy, Dr. Jordan, and patients like him?
Yeah, these results should be very durable, and in part that's because we can continue making adjustments. Tremor may slowly get worse over time. That's what these types of tremor tend to do, but because we can adjust it and continue to increase stimulation, we typically can get a very durable effect.
And how often will someone come to you for follow-up care?
So typically between 2 and 4 times per year. But if things are going really well, we may see people about every once a year just to check on the device and make sure the battery's working okay.
So Billy, what would you like other patients to know who might be thinking about this? What should they know about this procedure and what happens after?
Well, I guess one thing is to know that it's very little pain, at least in my case. It was immediate results when they turned the device on after a couple of weeks after the second surgery. So, you know, I could, on the first day they turned it on, I could already write again, and I could already hold my coffee cup without it spilling. And play music, you know, so not everyone's a brass player, so that may not be a consideration for everybody, but all these little day-to-day things, just reaching and picking something up, dropping things because you're not getting a good grip, or you push it out of the way because your hand's moving when you go to grab something, is all very annoying, and you don't realize how nice it is to have steady hands until you don't anymore. So, you know, to me, it's been just really a godsend. It has changed everything. And I have a lot more confidence just dealing with people, teaching music lessons. I can demonstrate for students, and that was getting to be impossible.
So has he played music for you yet, Dr. Jordan?
Yeah, and actually he brought in his trombone to clinic today. We wanted to, that was the true test of all of our programming, whether it was easier to play. And so we did some programming today while you played. And so I think that was a really helpful way to, and kind of a unique way we get to treat.
Thank you both. It's been a pleasure to talk with you.
Thank you.
And thank you for joining us for Health Talks.